Good afternoon. I'm Steve Zieniewicz, President and Chief Executive Officer here at St. Barnabas Medical Center, and welcome to this afternoon, informational and educational afternoon, a webinar to present about updates and topics of research in COVID-19. I want to first thank our communities for your tremendous support of all of the workers here, our heroes, our frontline workers at St. Barnabas Medical Center. It's really through an amazing team that we have here, an interdisciplinary team, our physicians, nurses, respiratory therapists, and so many others that have provided that compassionate care that has done so well for so many of our patients. I'd like to introduce our chairman of the board, Mr. Bruce Schonbraun, to give a couple of words of welcome also. Bruce?
Thank you, Steve. I too would like to echo what Steve said and to welcome everyone with us this afternoon. As chairman of the board of trustees, I cannot express to you just how much pride I have in our team, physicians, nurses, healthcare workers. I truly am proud and humbled to be chairman of this board. I think, as you have seen over the past month, what has happened here has been pretty amazing, and Steve, too, you deserve as much credit, you and your team as well. We have an amazing group of people here at all ends, and the community, I believe, is truly lucky to have St. Barnabas here. I often say when I speak that there's nothing more important in any community than quality health care, and that at some point in one's stay in this community, either they or their family will wind up at St. Barnabas, and we have a pretty amazing team here, and so I want to echo Steve's point and really thank them for just an amazing performance, if I might say, during this crisis. I also would like to thank the community. I mean, the outpouring that came from my community, this community, was truly overwhelming. There was financial support, which was greatly appreciated. The emergency department and other areas of the hospital. There was so much charitable donations of food, supplies, equipment, emails, letters, and calls. And more than anything else, it was very special to see the way that the community and St. Barnabas Medical Center came together as one strong bond in this community. So again, I thank the community for their efforts, for their support, and I turn it back to you, Steve.
Thank you, Bruce. I'd like to thank you for your amazing and strong leadership for our organization. It really has helped to keep us guided forward and really accomplish amazing things here. We have two of our physician leaders with us this afternoon. Dr. Christopher Freer, who is the chairman of emergency medicine, and Dr. Russ Langan, who is the chief of surgical oncology. I invite now Dr. Chris Freer to give a presentation about our emergency department, which is a very, very busy place and is an amazing resource for our organization and for our communities. Dr. Freer.
Thank you, Steve, and thank you, Bruce. Thank you, the community, for the support. It really has been amazing, and you've touched a lot of people here, and we really thank you for that. Just walk you through what sort of from March to now, and you know, I look back at March 1st, it feels like it's 3 years ago, but this came in very quickly, and the emergency department, we prepare for things, but I don't think, you know, you can only prepare so much until it really comes, and then you have to start just going and doing with your instincts what you've been trained with. So to walk you through what happened is the emergency department, we realized quickly we had to segregate patients and identify potential COVID patients in the beginning of this. So we set up stations and tents. We put 3 different areas out. We had a green tent for healthy COVID patients, a yellow tent for sort of the intermediate COVID patient, And then we had a red area, which were the sick COVID patients. So we went from a very small amount of our patients were potentially COVID to a vast majority of our patients are COVID, and then back down again to a very small percent of our patients are COVID. And during that, we asked some questions and risk stratification up front with our triage nurses, who were amazing. And in the beginning, a lot of these patients did not need oxygen or support, and we had to really figure out which ones did. So I can tell you, I've been proud before, but I've been just humbled and so incredibly blessed and proud with the staff. And it wasn't just the physicians and the nurses. You had registration, you had housekeeping, you had transport, radiology, you had all different disciplines coming together, and everyone just rose up and didn't really think of themselves or their family. They just thought of the patient in front of them, which to me, I'll never forget, going through that and watching this. We're very fortunate to have Dr. Paul Udici and the critical care team. Not every hospital has what we have here, and I really need to take a moment and just mention them, because the patients that did meet the criteria that were sick, it was mostly respiratory issues and viral pneumonias in reaction to the virus that the body's immune system just overreacted. And with what they did with respiratory therapy, with nothing short of amazing, I think we're at 78 extubated patients, which is a number that Dr. Udici and his staff should be extremely proud of. And it really was, anesthesia came together. We had teams of anesthesias coming down to the emergency department and helping us intubate patients when they need to be intubated. It was a very sad disease, as you have read, for people in nursing homes and rehabs and subacute skilled nursing facilities. So we did see, that was a majority of the patients that were critically ill is what we were seeing. And I just want to take you through how quickly this came in. It went out just as quick in the emergency department. I know you hear a lot of things in the news, but right around Easter weekend, right after that, so we're talking mid-April to late April, it's like someone just stopped. And the patients, we had a lot of sick patients in the hospital, but the amount of patients coming for COVID symptoms dropped drastically. So now we're at the tail end or almost post-crisis phase, and we're doing everything for patient safety. And I have 4 kids. I tell my wife and kids the amount of protection and PPE and cleaning we have here, this is like one of the safest places right now, because we're thinking up front, do you have COVID symptoms? We have separate entrances in the emergency department, but those have gone down from 70 patients a day to like 5 patients a day. So now we're trying to make sure we're treating the rest of the community. And I'm not telling people to come in here with a sore throat, but we're very concerned that the disease prevalence hasn't decreased for acute heart attacks and strokes and appendicitis and diverticulitis, but we're getting a lot of mortalities at home that we're getting on the medic call, that people I think are wanting to stay away from a hospital because of what's happened. So we've done a lot of things and safety measures to make sure that we're safe for our patients coming here, and letting them know if you have symptoms that you need to call 911 and get yourself to the emergency department. I was on Monday, we had a acute heart attack and everything went perfectly. And that's the person that I'd be very worried if they waited at home, what the outcome would be. So we're still screening up front and segregating patients. Our housekeeping has been amazing. We have extra housekeeping, wiping every surface down. Our staff is masked, our patients are masked. We are testing patients. We're still keeping all the precautions. But as we get post-COVID into where we are now, I just want to reassure, and I'll be open for the Q&A for questions, the steps we're taking, because the concern is many patients are staying away, and those outcomes of the patients in the communities. I don't, any other questions I'll sort of save for the Q&A, but I want to again thank you, because the support, that parade was nothing short of amazing with all the towns that came together for us. The food that's been delivered, having the new emergency department and having, sorry, I forgot to mention that. We had a section with a separate door from our tent into an area that had 22 negative pressure rooms that were state of the art. And that's because we used a new section of the emergency department and made it our COVID unit. And if it wasn't for your support, we wouldn't have had that area. So that was an amazing win for us to be able to take a separate entrance for these patients keep our other patients safe and treat these patients in a manner that we wouldn't had prior to construction. So I want to thank you for that.
Thank you, Dr. Freer, for your presentation, your leadership, and your team's leadership, and the way that you team functioned at such a high level at very stressful times. We appreciate that. I'd now like to introduce Dr. Russ Langan. Dr. Langan is our Chief of Surgical Oncology, and he will give an update on research and what we could expect potentially in the very near future. Dr. Langan.
Hi, good afternoon. I just want to take a moment and really say, you know, I chose to leave New York City and practice at St. Barnabas Medical Center because I believed in the product and the leadership. My own family has been treated here and have been operated on here. And wow, did the COVID pandemic just absolutely solidify this sentiment. I mean, I'm just immensely proud to be a member of this medical community, and I would be a patient here any day. Thank you very much for keeping us in your thoughts. I just want to go through some really day in and day out of what's been happening here at your hospital and give you some data. To start, I'll go through a little background of the COVID pandemic in New Jersey. I will go through the data with respect to St. Barnabas Medical Center. We will then address some testing at St. Barnabas Medical Center, research, and future endeavors. So for New Jersey, as of a few days ago, we had over 157,000 confirmed cases. As you can see, Essex County fell a near a third on the list with approximately 18,000 positive cases. And as what Dr. Freer was saying, you could see it was really a fast on and also kind of a fast decline. So cases certainly have been moving in the right direction from late April to the present. With respect to those patients that were getting sick and admitted to the hospital, the comorbidities that really drove this were cardiovascular disease, diabetes, and other chronic diseases. And this is a graph specific to the New Jersey population. For our institution here at St. Barnabas Medical Center, we tested a total of 8,107 individuals. 2,871 were positive, and that gave us a 35.4 positivity rate. To date, we have had 805 COVID patients discharged from this institution, and we have successfully taken 78 patients off of ventilators during this pandemic. At our peak, we saw COVID numbers here above 500, and now we only have 56 positive inpatients and only 16 patients remain on a ventilator, where at our peak we had about 120 patients on ventilators. And as Dr. Freer said, we really have to give our hats off to the critical care team led by Dr. Paul Udici and Bobby Rizai. They just were above and beyond 24 hours a day. With respect to testing, another thing that this institution just did exceedingly well was they had an early, robust team approach to testing employees. And by testing, I mean by the SWAB technique. So there were physicians, administrators, nurses, and site leaders put into place. We transformed the previous KinderCare location to a drive-through testing facility, and this just worked absolutely swimmingly. As of about a month ago, just to give an example, we had tested about 700 employees at a 33% positivity rate for those who had symptoms. And that ranged from residents to nurses to other staff members. And the rate really ranged from 24 to 36%. The testing platforms which were used here are either a 24-hour to 72-hour platform. We have a rapid test where reagents are administered by the federal government called the CEPIAD test. And then we also have a test by Abbott Labs. It's an M2000 platform, and that is a 6-hour turnaround. So we were utilizing all of these here on campus to get our employees tested. I want to go over something that's just absolutely cool. These slides are courtesy of Dr. Miller. I gathered the data from him and put these slides together. With respect to OBGYN and testing on labor and delivery, in New Jersey, as a state, there were about 450 total positive pregnant patients. Here at St. Barnabas Medical Center, we saw 35 positive pregnant patients with COVID. And in particular, one was a woman who was 28 weeks pregnant, who had advanced COVID and was critically ill in our ICU, pregnant with twins. A decision was made by Dr. Rezai in the ICU and Dr. Miller from OBGYN to perform a emergent C-section in the ICU. That was performed, the twins were delivered, and the mother made a rapid and full recovery after the babies were born. They've all been discharged. They are all home. She started out as a critical patient. This is something that the critical care team is currently publishing. And it was just an amazing team approach to get this woman and her children home safely. With respect to pregnant people across the system, we were at the higher end in 35 pregnant females, and other hospitals range really between 5 and 40. With respect to testing for labor and delivery, mandatory testing on admission to L&D started on April 5th. As of a few weeks ago, they had tested over 400 patients. And out of the 400 plus patients, 26% were positive. That was a 6% positivity rate at that time. And 25 out of the 26 were asymptomatic. Dr. Miller did state that this data was a little lower than expected. Other institutions were reporting positivity rates of 13 to 30%. He just felt that the demographic for our capture area were more strict on quarantine behavior. With respect to research, over the last 2 months, St. Barnabas Medical Center has had an exceedingly robust research endeavor. We currently have over 14 approved IRB, that's the Institutional Review Board here, approved studies. And all of these studies are dedicated to either improving patients who are currently battling COVID or improving long-term outcomes. And it's something you should all be very proud of, that this institution has this level of research ongoing. For treatments, we have used all the medications you've heard on the mass media. We have given patients remdesivir. We have given patients anti-IL-6 to adjust the immune response. We have used hydroxychloroquine. We've used hydroxychloroquine and azithromycin. Just for your own information, I present to you an article that was published in The Lancet about a month ago that really looked at what the potential efficacy would be for hydroxychloroquine plus or minus azithromycin. That was an antibiotic that was coupled with this drug. 671 hospitals over 6 continents were studied, and the outcomes of interest were in-hospital mortality and cardiac arrhythmia. This study assessed over 96,000 patients, and in the treatment group, the group that got these drugs, there were 14,888 patients. When compared with mortality in the control group, so group of patients that did not get drug, the hydroxychloroquine patients, the patients that got hydroxychloroquine with antibiotic, chloroquine, or chloroquine with an antibiotic, all had statistically significant increased death in hospital and also increased cardiac arrhythmia. The conclusion from this study was that the group was unable to confirm a benefit of hydroxychloroquine or chloroquine when used alone or with azithromycin. Something that you might not have heard on the mass media. One other treatment which we used here at St. Barnabas Medical Center was to deliver convalescent plasma to patients. You may have heard this over the news for the last few months. Well, what is convalescent plasma? It is created from patients who have recovered from COVID. If you had COVID and recovered and you are 14 days symptom-free, you can donate plasma at a certified blood center, and then that plasma can be delivered back to a patient currently suffering from COVID in the hospital. If you are looking at the slides, you can see that our blood is made up of different components, and the plasma is the yellow at the top. We would look at this plasma and assess for neutralizing antibodies that could attack the virus to a dilution of at least 1 to 160, and then that plasma would be shipped to us from a certified blood center, and then we would administer this back to patients. Well, how do you get it? You have to be on a clinical trial, actually. The clinical trial that enrolled the largest amount of patients was based out of the Mayo Clinic. It's called the Mayo Clinic Expanded Access Trial to Plasma. I will say I'm very proud of this institution and the team we put together here to deliver plasma, because we gave plasma on this trial to patient number 36. Okay, and currently this trial has treated 18,543 patients. So we were one of the first hospitals in the country to be delivering convalescent plasma. It remains an experimental therapy with massive regulatory requirements, but I will tell you anecdotally, there have certainly been patients that rapidly improved and left the hospital who were in a critical care state after receiving plasma. And we have treated over 90 patients to date here at this institution. With respect to future directions, remdesivir, as you know, is now being distributed by the federal government, and we continue to get more drug here from the FDA. There are other clinical trials which will be opening for less critically ill COVID patients. One is a randomized trial run by Dr. Sabrodo Paul, and the second is another randomized trial which will be run by Dr. Bobby Rezai. With respect to future testing, the operating rooms as of June 1st have now opened for standard of care business. All preoperative patients are being tested within the 96-hour window per our governor. Also, for the last few weeks, all cancer patients have been treated prior to coming into our cancer center. We have also purchased 2 new machines. One is called a BioFire, which will be able to test for COVID along with common strains of the flu. So instead of running 2 tests, you can run 1 test. This will be important for us come next fall. And then also we purchased a Roche machine, which is a very high throughput instrument, has less hands-on prep. We can run 380 tests in an 8-hour period. So we are really gearing up and getting ready for a potential rise come next fall.
Thank you, Dr. Langan, for your up-to-date and informative overview of where we are and the great work being done here at St. Barnabas with leaders such as yourself and so many others. At this time, I'd like to open it up for a question and answer. I do have a couple of questions that I will lead with. First, I'll ask Dr. Langan. There are reports that many of the tests for COVID are not accurate, that there is a degree of false positives and false negatives. We hear that antibody testing is not proven to protect people against reinfection. Why is everyone insisting on being tested?
Thanks for the question. So let me say, with respect to the tests that are being done by this institution and most hospitals, they are exceedingly accurate. They have a specificity of 100% and a sensitivity of 99.6%. The tests that are not accurate, that you may have heard on the local news a week or two ago, are antibody tests being done through a finger stick. They're called lateral flow tests, rather than venipuncture tests, which are done through a blood draw to test for antibodies. So what we currently have here on campus to test for antibodies is an accurate test. Now, the question remains, though, is what does that antibody do for you? Okay, we don't know if a patient who tests positive for an antibody actually has immunity to the virus. We don't know if it's a neutralizing antibody. It just means they've been exposed to the virus. So across the medical community, it remains unclear, unknown as to what these antibody tests are going to be useful for. We certainly, not we, I will tell you that, the FDA and CDC are certainly recommending no one use antibody tests to bring people back to work. That said, everyone wants to have it. I've been antibody tested. I am actually antibody negative, and I was hoping I was going to be positive, but we don't really know what it's really going to mean.
Also, Dr. Langan, on the testing, I know that Rutgers has recently developed and rolled out a saliva test that is somewhat easier to administer and so forth. Is that falling into the same categories that you described about diagnosing for COVID?
Yes. So whenever anyone speaks about testing, we have to be clear that there are testing for active virus in a patient, and then there's antibody testing. And many times we just use the word testing. The saliva test is the next generation of the SWAB. And as you all know, the SWAB technique is significantly more invasive. It's not a swab in the nair, it's actually a swab in the nasopharynx, which is towards the back of your head. I mean, the thing really goes in you absolutely, inches, right, Chris? I mean, so the saliva test is the next generation. It is as accurate as the swab tests, okay? There's no downside to getting the saliva test. In fact, some people have made statements that it's actually more accurate. I don't know, but I can tell you it is as accurate as the traditional swab technique. So I would feel very comfortable utilizing that viral testing method.
And vaccines, there's a lot of discussion that having a vaccination is really going to be very key to controlling this virus going forward. What are the updates on the vaccination?
So there's no doubt, I completely agree with you that really to get back to normal, we need a vaccine. Like, we're getting back to a new normal now, but it's not normal, right? In order to get back to the world we were living in, we need a vaccine. We need a vaccine that's effective and can be mass produced and given to populations. Realistically, the medical organizations are saying it could take a year. Some in the more optimistic tune are saying maybe 6 months, but you're really looking at, I'd say, 8 months to a year to have a vaccine. Vaccine trials have been positive so far. I mean, what is coming out of a few of the small trials, small number of patients being treated, they have mounted a response. So that's a great sign, but we're really looking at, in my opinion, 8 months to a year before we are really treating populations of patients. Fortunately, a number of our biotech companies and pharmaceutical companies are already ramping up production facilities so that when a vaccine has been produced, they can then mass produce it. Okay, so once we know it's effective, I think the rollout will be significantly faster than we've ever seen in this world. In particular here in the United States, I think we're going to be the leading producer of vaccine. But in order to know whether it's going to be the vaccine that works, could be 8 months, could be a year.
Okay, we'll have to be patient. I have a couple of questions for Dr. Freer. We've heard about that we're expecting a second wave. What is your prognostication on when this may occur, Dr. Freer?
So we're coming to the end of the crisis phase, right? So there's the crisis phase, the pre-vaccine, and the post-vaccine. So if I had a crystal ball and I could tell you it's coming back next March, I'd be lying. I don't think anyone knows. We do think, and experts think, this is coming back. We're preparing for it to come back, but this is brand new. It's not like influenza, which we've been tracking over time. It's a different virus, different family. So, we're planning for the fall and winter, but we don't have an exact time. As Dr. Langan said, the vaccine is what I think to get back to normal, that's the post-vaccine phase. So we got a little time between end of this crisis to that post-vaccine phase. And in that time, we have to prepare for it to come back.
We've learned an awful lot, and I think have a lot of preparation in place. But what would you do when and if the second wave does occur? What might you do differently?
I mean, as a state and a country, we need to test and track better. We need to get the outbreaks when they're tiny before the horse is out of the barn. So as an emergency doctor and director, I'd like to do what we did with our tents and our triage process, but I'd like every single patient that walks through the emergency department to have a test, if possible, in a short amount of time that I could tell you this is influenza, this is COVID, or this is some other virus. That would be tremendous for many reasons, for obviously the patient and for separating patients and PPE and protecting our staff and our patients. So I'm optimistic with what Russ said in regards to the testing next round or coming around, but testing is something we need to do different and we will do differently.
Great. Thank you. I'd like to invite closing remarks from Dr. Langan and Dr. Freer. We can start with Dr. Langan, closing remark.
Closing remarks are really that the word pride doesn't even describe the feelings that I and anyone you speak to have. I mean, if you were in this hospital working during this crisis, I think we just did so well, and it really solidifies for me, why I am here. And I would certainly turn up as a patient, bring my family here any day. And thank you to everyone on this call for keeping us in your thoughts.
I'd have to just echo what Dr. Langan's saying. I mean, it was amazing to be in the thick of it in the emergency department and just watching every member of that emergency department going to work, brought their lunchbox in like it was any other day, and they just rose to the occasion. And the pride I have, I've been here for 22 years, and we've seen some things. I've never seen anything like this, and I couldn't be prouder of how the entire hospital responded. It wasn't a silo of different areas. It was the entire hospital coming together and said, we need to work together, and this is coming at us fast and furious. What do we need to do? Let's open that command center. All the physician chairs got together and worked in a way. I've been close with the chairs before, but I've been with the chairs of the major departments every day for the last 90 days. And that's something I didn't do before. And the bond we created to work together with our administration and our nursing leadership was something truly amazing, and I'll never forget.
Thank you. I'd like to thank first our chair of the board, Bruce Schonbraun, Dr. Russ Langan and Dr. Chris Freer for this evening, and also thank everyone who's participated this afternoon on this informative webinar. Again, once again, this is our hospital, your hospital, the community's hospital, and your support in all different ways really makes a difference for our success. So thank you all, and I would invite maybe Dr. Langan and Chris Freer in another month or 6 weeks. This keeps changing, that we perhaps have a follow-up webinar and to give what's happening at that point.
Absolutely.
Sounds good.
Good. Thank you all. Have a great night.
Good evening. Bye.
Thank you.
Hello, I'm Steve Zieniewicz, President and Chief Executive Officer at St. Barnabas Medical Center. Welcome back. Now that we are well past the peak of the COVID-19 curve in New Jersey, St. Barnabas Medical Center is moving forward and ready to receive you for your healthcare needs. We are in conformance and adherence to all of public health guidelines and regulatory policies. Over the past couple of months, you may have delayed some of your healthcare needs, such as mammograms, special procedures, or elective surgeries. Please know St. Barnabas Medical Center safety is our #1 priority. Some examples of the processes that we have in place for your safety include at all of our entrances at the hospital as well as in the ambulatory care center, we have a medical screening that occurs. Our healthcare team will greet you, ask you a few very brief medical questions, do a temperature screening, and provide you a mask if you need one. And we ask that you wear that mask while you're in our facilities. Other things that we have in place that have always been in place is excellent hand hygiene and disinfecting of all of our services. Social distancing or physical distancing is very, very important also. When you enter our facilities, you will see that in the lobby and in the reception and waiting areas, the seats are thoughtfully and appropriately placed a distance to create that safe healthcare environment. We have testing available for those coming in for their elective procedures so that we know their status and that we continue to create that very safe environment. A special thank you to all of our employees, our healthcare workers, our healthcare heroes, for your tireless dedication during this very challenging time in providing the compassionate care for our patients. Finally, we want to thank all of you for your support, the community support for our healthcare workers. Through the safety and the partnering in safety with you and our team, we have discharged over 750 patients that came in with COVID and now are healthy back in our communities. We want to thank you. We need to continue to partner for that safety. And welcome back once again. We are ready to deliver your healthcare needs.